I think as consumers and members, we need to talk more about men's health and share with the friends, brothers, fathers, and partners that we have to learn more about the benefit of engaging early on in their health and also helping them much easier get access to the solution. And I think by making it a conversation and creating more awareness, I believe everyone wants to be healthier. It's just like sometimes it's not easy to engage in their health.
The current system or reimagine something new? Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show. This is a mission, y'all. As healthcare leaders, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want you to understand how these options work and why they might be right for you and your loved ones. Here's what's going down today. First up, we have the Flava of the week about the launch of Perplexity Health. How is Perplexity staking its claim to being the most trusted AI engine for health answers? And how can we make an unbiased effort to evaluate new health AI platforms from the consumer's point of view? I'll talk about that. Then I speak with Reza Amin, CEO of Bastion Health, about founding the first nationwide virtual men's health clinic, access gaps that may surprise you, and the scope of outcomes that can be improved when more men are willing to be part of the health conversation. I'm Jared Johnson. Let's get it.
Flava of the week.
Perplexity has entered the health AI chat and has already staked their claim to being the most trusted source for consumers. They announced Perplexity Health on March 19th, asserting that they're the best place to search for this kind of knowledge because of their focus on accuracy, credible sources, and verifiable citations. Now, if you're keeping score, that's at least the fifth major health AI platform announced in the last 10 weeks following ChatGPT, Claude, Amazon, and Microsoft. According to their press release, Perplexity Health is a suite of connectors to your personal health data that allows for powerful personal uses of Perplexity Computer, providing accurate health information for the most important questions. They're launching with connectors for Apple Health, electronic health records from over 1.7 million care providers, and platforms including Fitbit, Ultrahuman, Withings, and many more. These are powered by partners like BeWell and Terra API, along direct integrations, and Aura and Function are expected soon. They also announced the Perplexity Health Advisory Board, a group of physicians, researchers, and health technology leaders who will pressure test their future product decisions, content quality, and clinical safeguards against the standards of evidence-based medicine. Perplexity Health on Computer will first roll out to Pro and Max users in the US in the coming weeks, with more cohorts and geographies coming soon. What's the consumer lens? Pair Perplexity Health's launch with Rock Health's report released just 4 days later on March 23rd, titled The Tortoise and the Hare of Care, Health AI Insights from Rock Health's 2025 Consumer Adoption Survey. It explores select data from their 11th Consumer Adoption of Digital Health Survey from December 2025 that asked a cohort of 8,000 US census-matched adults about their behaviors and attitudes toward virtual care and digital health tools. I'll be diving deeper into the report next week, but a couple of their findings have been splashed across my LinkedIn feed all week. 32% of respondents, or 1 in 3, reported turning to AI chatbots for health information, double their share from just a year ago. Other more established digital channels for health information, such as online search and health websites, are still more pervasive than AI chatbots, and by comparison, grew in use by 3 percentage points in the last year. And finally, don't forget this one. 64% of AI users engage with it for health questions weekly or more often. In summary, for many, AIs quickly become a routine part of how they manage their health, and I think that's progress that would only come from big tech entering the space. Yeah, you heard that right. After all, consumerism is all about being empowered with choices that meet our needs and expectations. And after decades of attempts to do that in digital channels, let's just say that traditional healthcare as a whole still has a long way to go. Let's make an unbiased effort to evaluate new health AI tools from the consumer's point of view and acknowledge how quickly they're being turned to for answers. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week.
The flow, the flow, the flow.
All right, everyone, let's get into the flow. Please give it up for my guest today. I'm here with Reza Amin. Reza is the CEO of Bastion Health. They're the first national virtual men's health clinic. I was mentioning to Reza right off the air here that this is a topic that Zain and I are looking forward to diving into more this season on the show. It is a topic that I'm looking forward to hearing more about Bastion and what Reza has learned as he's dived into this area. Reza, welcome to Healthcare Rep.
Thank you for having me, Jared. Very exciting topic and conversation, but I'll start briefly about myself. In the past decades, I was doing a lot of research on digital health and medical device health technologies. By training, I'm a system engineer. So I try to break systems and build them again and fix them in order to fully align with the other sort of like subsystems and systems that are in the spaces. Same thing applied to digital healthcare space and when it comes to men's healthcare. But before that, I'll start with a personal story. Around 8 years ago, me and my wife, we went through fertility journey. And that was an aha moment for me, seeing that really men's health is not accessible. Back then, I remember one day trying to be a responsible partner. I went with my wife to her OBGYN and I was like, I'm a scientist. I know I'm half of the problem. Nobody's talking about me. And you'll keep testing and doing all these invasive testing on my wife. And she was like, you're not my patient, but go see your doctor. Potentially you need to get tested. So I was like, I don't have a doctor. And longest story short, I started talking to a PCP, getting a referral to a urologist and men's health specialist, and start getting the testings and treatments. But back then, my wife had access to digital health, women's health, and OBGYN services in parallel to the in-person OBGYN. She was able to get all those supports. And that was the initial point of Bastion. We started Bastion Health around 5 years ago. And at core, we are medical practices, virtual medical practices in all the 50 states. And then on the top of that, we have our AI-enabled telehealth and at-home diagnostic kits that helps men in the comfort of their home do comprehensive testing and talking to board-certified men's health specialists in order to do a complete assessment, start their treatment. And when there is a complex case, they get referred out to in-person clinics.
Tell me a little bit more about that moment when you realized that when you said, I don't have a doctor, like I don't have access to some of these specialties and some of the things that at the time would have been very helpful in your health journey. Like how deeply did you look and before you realized that, yeah, there's nothing really out there for me in this instance?
Interestingly, I didn't have a relationship with a PCP. That helped me to start talking to a PCP first. But then the PCP scope is also limited. So I needed to go talk to a specialist. Back then, I remember I used to drive about an hour to get to a place to do semen analysis and then to find a urologist. It took me 4 months to see a urologist. So the stats shows that around 61% of US counties, they don't have men's health specialists and urologists. So even if a guy wants to be responsible and engage in their health, there's a big access gap. And that's one of the problems that I saw firsthand. Plus, we see day to day, our patients are looking to find a urologist. They can't immediately see a urologist. They come to Bastion in less than 3 days. They talk to a specialist.
Let's walk through kind of how that experience works for somebody. Let's start with even how they find out about it, like how people are coming to Bastion and learning about it itself. Is it a referral basis or are you going direct to consumer, just offering this to anybody? Let's start there in terms of how people find out about it.
Yeah, so our platform is available and anyone online who's interested, they can join our program. They can go on our website and join our program. Though we are not doing any advertisement direct to consumer. Our distribution channel is mainly through enterprise clients and employers and health plan partnerships. And that's how we basically offer our solution as the first men's health solution offered to these large employers in order to help them engage the other half of their population in their health and improve the outcome and save them cost. But when employers offer the solution to their employees, of course, the partnership is benefiting both of us. We do communications and marketing and educational sessions for their members, and then they learn about the program, they join the program, and that's when we start the holistic support on men's health, which they may come for one condition, but then we make sure that we identify the gap in care and do all the preventative and screenings that they need in addition to the main condition they came for.
Got it. Okay, so you're designed for consumers and for enterprises then.
Yeah, so we made sure we design our solution for consumer, but we align with health plans and health systems and other players in healthcare. And we didn't want to create another silos. I think one mistake that a lot of direct-to-consumer solution makes is to design a solution which is great for consumer, but it doesn't have a lot of alignment. And as a result of that, it's a silo. Clinical notes are not available to other providers. Prescriptions are not available for primary care doctors to even follow up on those cases. But at Bastion, we made sure we are fully integrated into healthcare system. So whatever diagnosis or treatment we start, other providers that are managing that patient can also see all those clinical notes and support that patient further.
Let's talk about what complete men's health actually means in practice. I think that's how Bastion Health refers to itself, is that you offer complete men's health. Tell me about what that means.
Let's start with an example here. If you Google men's health, and potentially one of the first advertisement you get is ED or hair loss. But men's health isn't just ED. It's about prostate health, reproductive health, hormonal health, colon cancer screening, cardiometabolic, mental health. And all of those are conditions around a patient that we need to manage in order to holistically support them. A lot of time, patients might have diabetes, and as a result of that, ED is one of the symptoms and comorbidities they have. So in order to treat a patient comprehensively, we need to make sure we have all those data points and we screen patients for all of those so that we can diagnose them appropriately and treat them appropriately. So when we are talking about comprehensive men's healthcare, we're talking about preventative and performance based on all the clinical guidelines. We put together all the programs around a male patient so that we support them from different angles, 360, and making sure that there is no gap in care. As a result of that, the outcome is better. And for those health plans and large employers, there's a huge opportunity for cost saving.
I definitely have had times when I didn't feel like I had a doctor-patient relationship with a primary care provider myself, right? And there are times that I have, and I'm grateful for it. Is that part of the challenge, is getting men used to even the fact of how they can benefit from a relationship with the doctor? Because this is more than just the provider themselves. There are these other services and solutions that you're offering them. I just wonder if that's even just part of the challenge of just getting men used to a relationship with their doctor.
There are a few challenges. First is access gap, and we know that there is an access gap. So let's say we solve for the access issue. The next issue is the engagement and simplicity of the system. We know today's healthcare is complex. Even if I worked in the healthcare in the last 10 years, it's complex for me. When I go to my in-person doctors, when they place a referral and nobody call me back, it's complex. I need to spend a lot of time trying to follow up in order to get my next colonoscopy or in order to do an imaging, and requires prior authorization and those kind of things. So healthcare is complex. And if someone is not from the get-go motivated to engage in their health, you can easily find them unengaged in the system. As a result of that, data shows that 55% of men are not engaged in their health in the traditional healthcare setup. So that's one of the problems we need to solve in order to engage men. And we want to make sure it's first accessible, then it's simple and engaging. And as a result of that, then the solution needs to make the process easy. Plus, we need to have someone who's care navigating patients through the process and hand-holding them through the process. Usually, females are in the households or the chief medical officers taking care of the health of the family. They do a lot of follow-ups, making sure kids and their partners have appointments lined up. But basically, men, when they come into engaging in their health, a lot of time they get lost. And at Bastion, we have dedicated health coach and care navigators, which helps them walk them through the journey, making sure they are picking up their medication, starting their medication, and making sure if they have any side effect to schedule the next visit with the provider. And if they need a referral, we place that referral, do all the prior authorization, making sure the result of the imaging, let's say, is available so our doctors can again review those results. So connecting all those dots and solve for fragmentation in the healthcare is another challenge of today's healthcare, which we solved it by having dedicated care coordinators for patients.
It sounds like you're not positioning this as a replacement for local providers. You're positioning as a partner to health systems, to employers, to others. Tell me how that conversation typically goes when you are helping a healthcare organization understand how this benefits their patients.
Yeah, the good thing is that a lot of enterprises already adopted women's health solution, mental health solutions, at-home physical therapy solutions, and they have seen the benefit of having accessible solution that brings ROI and makes our job a little bit easier. We go to these large enterprises, we solve for access and engagement. And now the next thing is to show that there is a clear outcome and cost saving. And for us, showing that we have 7-to-1 ROI makes it a no-brainer for a lot of these employers. They already have solutions that they see a clear ROI on the women's health side. Now we are engaging their male population in their health. Again, 55% of men are not engaged in their health. A lot of time, there are later stage diagnostics and high cost claims. And Bastion engaging and doing a lot of early diagnosis, we save millions of dollars for these large enterprises. And it makes sense for them. For a lot of these health plans, we close the access gap. They know that there are a lot of counties that they don't have any men's health specialists and urologists. And Bastion being the top of the funnel solution helps engagement early on. And then when there is a complex case, we refer them out, we handhold them, connect them with in-person clinics, with imaging centers, with for biopsies or for any procedure, and making sure that the patient, we close the loop and patient is landed on a place that they can get the full comprehensive care.
I would think it wouldn't take that much convincing, to your point of being able to engage a whole side of a cohort of employees or patients who, you're right, just up to this point in men's spaces, I don't know how often we talk about health, definitely not in the same way for the most part, at least, again, those who I surround myself with. What do you hope is the good that we can do as you engage men in their health? Like, what specific ways do you hope to influence men's health for good?
I think early detection is key. Having a lot of later stage diagnostics in male population, which of course results in a lot of cost in healthcare, but also at the individual level is losing a lot of lives. It's a lot of burden on the families, and defining men's health as a family health solution is important because we are basically helping a lot of families to be healthier in general. And for us to be able to detect and diagnose conditions early on and manage them at early on, which are more manageable, it's one of our main goals. To give you an example here, to save a colon cancer or prostate cancer early on, or to identify a prostate cancer or colon cancer early on, it saves around $300,000 to $400,000 in the next 4 years for that patient. And we know that there is also a lot of burden on the patient itself, emotionally, and a lot of burden on the family. So it's a huge opportunity here to not only save cost, improve the health of the population. And we know men's life expectancy, it's much lower than the average, and we can help them be healthier and improve the health of the population at whole.
Personally, my father-in-law passed away from prostate cancer. It wasn't diagnosed till it was stage 4. So this resonates. I mean, he was in his late 60s and probably a little over a year from the time he was diagnosed until the time he unfortunately passed, and rest in peace, right? But that experience going through that with him, with my father-in-law, has influenced a lot of what interests me in driving more people to engage in their health. And so this couldn't be more relevant. It couldn't be more important. And I welcome the conversation, right? Because I just see so much value in helping us see a different side of the equation, maybe that needs just as much specialty and just as much expertise and just as much of a kind of customized solution here as other areas of healthcare do. What can you tell us about where Bastion's focusing for the next 24 months? Kind of what's coming on that near-term horizon for you?
Currently, we have more than 50 enterprise partners and health plan partnerships and clients. The next phase for us is to focus on deepening our health plan partnerships and make sure that we are covering a larger population and expanding our partnerships with other players in the healthcare, including the care navigation platforms and solutions, and also leverage more and more the AI tools that are available to help get more insights and enable our providers to provide higher quality of care for our patients. So in the next 12 to 24 months, our focus is to basically, as we are now defining the men's health as a category, being the leader in the B2B men's health solution and help larger population benefit from early diagnosis and being more engaged in their health through a simple, destigmatized solution, which is available in the comfort of their home.
I want to give you a final word, anything we haven't talked about yet or addressed, that if you're speaking directly to our audience who, again, we remind them, a lot of our listeners and viewers are working in healthcare, they're healthcare leaders, but we encourage them continually to remember the point of view of yourselves as a health consumer. Whether or not you work in healthcare, everyone's a health consumer. So we're all trying to see whether solutions or other things we talk about on this show are helpful for them or their loved ones, other people that are in their lives. If you're speaking directly to our audience and have any message for them as health consumers, what would you say to them?
As consumers and members, we need to talk more about men's health and share with the friends, brothers, fathers, and partners that we have to learn more about the benefit of engaging early on in their health and also helping them much easier get access to the solution. And I think by making it a conversation and creating more awareness, I believe everyone wants to be healthier. It's just like sometimes it's not easy to engage in their health. We need more conversation around this. Every time I'm on a podcast or talking to someone, they know someone or some of their sort of like close family members have been diagnosed by prostate cancer. And I always say, if President of the United States has been diagnosed by late stage prostate cancer, then the normal citizens, of course, are also missing a lot of late stage diagnostics. So let's really be talking about this and also create more awareness and invite family members and sometimes handhold them in order to have the initial engagement with their healthcare solutions. And then I think from there, as they experience the benefit of that, hopefully they stay engaged in the solution.
Reza, thanks for joining us. Thanks for everything you're doing to help make healthcare consumer-centered, and all the best wishes for where you're going with things. Can't wait to see what's next for you.
I appreciate it. Thank you so much again.